In Alberta, more than 24 doctors, scientists, union members, and university professors have asked the federal government to sidestep the province and directly fund provincial classrooms to make them safer from COVID-19. And in a separate letter, pediatricians say they're extremely worried about the province's decision to eliminate COVID-19 testing. Children who can't be vaccinated yet head back to in-person schooling in the coming weeks. In a letter sent earlier this week to Premier Jason Kenney, the Alberta Medical Association section of Pediatrics urged Kenney to delay the removal of monitoring measures until 85% of Albertans have been immunized. For more on that, we're joined now by a signatory of that second letter from pediatricians. Dr. Michelle Bailey is the president of the Pediatrics section of the Alberta Medical Association. We reached her in Calgary. Welcome to the show.
Good morning.
The letter asks the province to delay this removal of monitoring measures until, the golden number, 85% of Albertans have been immunized. How did your group come up with that threshold?
I think the main thrust of our letter is to have some science and some measures that we could reach to ensure better safety for our kids going back to school. We have 660,000 unimmunized children less than 12 in the province of Alberta. A number like 85% of vaccination enables enough people to be vaccinated, protected, along with innate immunity if people have had COVID before, to prevent more widespread dissemination of COVID in the community, which can then keep kids safer at school. There's obviously measures in schools as well that we're asking for. The province also reduced the mask mandate, and masking is one of those things in an internal school environment that could prevent spread of disease. So while there's no magic number here, this is just one type of indicator that could improve the risk for children who are unimmunized, and we're not there yet, even close to 85%.
Right, and we know that as a whole, children are less affected by COVID-19, particularly when it comes to more severe illnesses and side effects. How does ending the mandatory masking and testing put children at risk?
Yeah, so we're very fortunate that COVID has been less impactful for our children in terms of severe disease. However, when large numbers of the children are infected, we do see severe COVID in that smaller percentage. We also see post-COVID syndrome in a certain percentage of children, so that's long-term side effects and symptoms similar to adults. And indeed, we see the post-COVID MIS-C or multi-system inflammatory disease in children. And when we are talking about the current fourth wave, we're seeing extremely large numbers of children being infected in areas such as Florida and Louisiana and other areas of the world. And it's those large numbers of infected children that can then result in, I think, unnecessary hospitalizations, ICU stays, and secondary effects of COVID. So that's despite the fact that children have a lower risk than adults. The risk is not zero for them.
In terms of timing, why send this letter out now?
Yeah, I think we're moving quickly through August, and parents are needing to make decisions about their kids going back to school. I think many parents were looking forward to moving their children from online to in-person schooling if they chose online learning last year. And this sudden decision by the province to remove testing in the community so that we're not aware of kind of what's happening in the community, tracing, isolation, and now uncertainty about masking in schools is just raising concerns for families who are now trying to decide what to do for their children this fall. School is exceptionally important for children. There's educational needs, obviously developmental supports, nutritional needs for many children, exercise, and most importantly, children's mental health has suffered greatly during this pandemic. A safe return to school for the vast majority of Alberta children is really in our kids' best interest.
What kind of response have you received from your letter?
Yes, we have not received a response from the government yet. We have heard that the school is still, or the government, apologies, is still in planning for the school plan. We have had a look at the base plan that they're currently working with, and we would be hopeful to have input on that. And I believe the government is willing to have some input on the school plan, which is good. I think, however, for testing, tracing, and isolation, which are those really essential public health measures, and the need to not move forward with those and delay those just for a little bit more time until we can reach this next set of children as targets for immunization. I'm not sure we're going to hear from the government about their response. I hope we do.
What's your thoughts on vaccine passports? Do you think that should be implemented for not just staff and teachers, but students 12 and over?
Yeah, vaccine passports are really interesting way to look at improving the risk for the population in terms of spread of disease. I think we have always supported that families make choices for their children in terms of immunization. We would wish that families speak to their physician and look at trusted sources of information when making decisions about vaccinating their children. We certainly wouldn't want barriers to children being able to get to school based on their parents' belief systems. However, there's certainly some interesting things happening in Quebec, for example, where they're using passports to limit unimmunized people's exposure to large events or public spaces indoors in a more general population basis. I think there's pros and cons to most of the actions that we're considering within COVID, and passports, I think, are in one of those categories. There's some real pros for really protecting those people who are unimmunized, potentially from being in a crowded indoor environment where the spread of COVID can go more aggressively. However, there's cons as well, especially when we're talking about things like schools, where our most important goal is for children to have access to schooling in person for them.
Thanks for taking the time to speak with us. Appreciate it.